Hi, my name is Anika Majaria and you are watching Dubai Life TV. I am at the American Hospital with Dr. Faraz Khan, who is a hematologist and oncologist. Thank you so much for being here today.
Hi.
Could you please talk to me about your role as a hematologist and oncologist?
As hematologist-oncologist, we deal with blood disorders, both benign and malignant, as well as cancers in general. So it's kind of a vast variety of different cancers, both what we call solid tumors and hematologic cancers, as well as like leukemias or lymphomas, in addition to some benign hematologic disorders.
And what attracted you to this field in the first place?
Predominantly, I would say the patient contact that you get in hematology oncology is very longitudinal, and you develop very close bond and relationship with most of your patients and families, and sometimes that bond stays even beyond the patient. As a physician, I think you get the most out of this field. The scientific element of new therapies, an evolving field, that makes it more interesting. But I think the main reason is actually the kind of a contact you develop with the patients is very longitudinal and very fulfilling.
With regards to diagnosis, are there any ways that we can detect these illnesses early?
Yes, many cancers can be detected at a very early stage. Breast cancer, being the most common example. Mammogram, starting between age 40 to 50 on every 1 to 2 years basis. Different countries and jurisdictions have slightly different recommendations. And the idea is that you pick up disease early enough to make a big difference. So you may not need all the therapies that sometimes are required to treat breast cancer. There are many cancers where, in fact, the majority of the cancers do not have effective screening program, or it actually does not make a difference. But for particular cancers, particularly the common cancers, it's a very effective tool, and screening has proven to reduce the morbidity and adverse outcome if cancer is picked up early on.
With regards to cancer, do you see it on the rise or do you see it improving?
I think cancer, if you look at in terms of incidence, certainly the incidence has risen, and cancer-related mortality has increased over the last, if you look at the last few decades. But I think it's very complex phenomenon. It's not just because we're having more cancer, but also we're detecting more cancer, we're treating more cancer, and patients are living much longer.
What are the biggest challenges that you face as an oncologist?
We still see sometimes patients presenting at a very late stage. We still see, breast cancer patients, even here in UAE, presenting at a very late stage, almost neglected to some extent. And I think there's a lot of social, sometimes stigma, barriers. Sometimes there's an issue of denial. And I think one of the biggest challenges that we're seeing, and we will continue to see over the coming, years, is the cost of the treatment. Cancer treatment is a very expensive treatment, and unfortunately, majority of the people do not have access in terms of financial support.
With regards to screening in cancer, what advice would you give to younger generations, say in their 20s?
Generally, in young patients, unless there's a documented familial or genetic cancer syndrome, like what we see with BRCA mutation in breast cancer, we do not recommend routine screening for young population. For example, if somebody is 25 and they have a very strong family history of breast cancer, first thing we look for is to see if the genetic mutation is present for the breast cancer, like a BRCA. And if it is present, then there are set guidelines at what age you start screening.
That was great advice. Thank you, Dr. Faraz Khan, for joining me today.
All right. Thank you.